This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
As cold and flu season ramps up, there's another virus you need to know about, especially if you have small children.
It's called RSV, respiratory syncytial virus. Syncytial virus. It's hard for me to say. What it is, it's a respiratory virus that generally comes across like a common cold, but in some children, it can actually turn very serious. Dr. Lauren McGovern is a pediatric hospitalist at PMRC. She's here with us this afternoon to tell us more. Say it for me.
Respiratory syncytial virus.
Syncytial virus. Okay. This is a really serious thing. What exactly is it?
So respiratory syncytial virus is a virus that causes bronchiolitis in small children. So bronchiolitis is where the airway of the babies gets filled with mucus and secretions and gets inflamed. So the word syncytial actually means together cells, to join two cells together. So this is why this virus is different than all the other viruses. So when this virus goes along, it crawls in through our mucosal surfaces, our mouth, our nose, crawls along, gets into their little air pipes, and it starts going from one cell to the next. And if you remember from basic biology, when you take two cells and you make one cell with two nuclei, that cell's going to die.
Right.
So what happens to that cell is it sloughs off right into the lumen where the air is supposed to be. So the lumen is now filled with mucus. It's inflamed. It's getting terrorized by this virus going from one cell to the next, causing havoc. And these little babies, their air pipes are so small that a little bit of mucus and a little bit of inflammation will cause their symptoms to be very serious.
Yikes.
Wow.
So you were saying, so small children are the most at risk for this virus?
They are. Small babies are the most at risk for this virus, under 1 year of age.
Okay.
Any premature babies who have smaller air pipes, premature babies are prone to having chronic lung disease, where they have already some scarring and inflammation of their airway, so that just adds more complexity to an illness if they were to get it.
Are there symptoms we can look for?
Yeah, so we look for specific things when we take a history from a patient in the winter when RSV season is around. So RSV is between the months of November and April. Once we see it, it's there. RSV is actually a virus that can live on a fomite, an object, for up to 4 to 6 hours.
Which is huge.
Which is huge. So you go someplace, somebody's coughing, hacking, you bring your baby along, you start letting them touch the arm of the chair, it's in their mouth now. It can also live on a human hand for up to 20 minutes.
Right.
So that's one of the reasons it's so highly contagious.
So what kind of symptoms can we look for?
Yeah, so the symptoms, babies come into the emergency room or, or they're at home, say, and they have coughing, a little bit of a low-grade fever, runny nose, cough, congestion. Sounds like a common cold, right?
Yeah.
So the key factors that we look for are they're starting to use their chest to breathe. Breathing is a natural thing that we do. We don't think about it.
Right.
When babies have to start thinking about using their chest muscles to breathe, we see them breathing. You can tell. It's called retractions, and some moms will come in and say, they're using their chest to breathe. That's a sign of RSV. We'll hear coughing, gagging. Think about how I told you the lumen, the air pipe gets filled with all this mucus.
Right.
There's no way to get it out except by pushing it out with air. So moms will come in. They're coughing so much they gag, they vomit. And that's another red flag that we think, this is. And then of course, so-and-so, the brother or sister had it last week, a similar virus, but this is way worse in our baby.
Okay, so we've gone over the symptoms. What about treatment?
There's no treatment for RSV. It's just supportive care. So a lot of times we have to be very proactive when we see little babies that have high risk for this illness to be worse. We're extremely proactive. We might see a baby who tests positive for RSV on day 1 or 2 of illness, and they might actually look decent. But we know things are getting worse. We know that it gets worse on day 3 to 4, and sometimes if they have high risk factors, we'll actually observe them and we'll be very proactive. If they do make their way into the hospital because their chest muscles are being used to breathe and they need help with some oxygen, we'll admit them to the hospital with oxygen support. Sometimes we'll, frequent suctioning, we'll train the parents on how to support them through this illness.
We could talk with you about this for a while, but I'm out of time. Tell me real quick, is there anything we can do as far as prevention?
There is. So premature babies who have high risk factors such as chronic lung disease, prematurity before 29 weeks, a hemodynamic significant heart defect, we can give them a injection monthly called Synagis, which is a monoclonal antibody that the babies can be given. It's a preformed antibody that can prevent them against the virus. And it's very effective. And they do it monthly with their community pediatrician, but only for those high-risk populations.
You used a whole lot of big words, so best thing we could say is talk to your doctor.
I think that's a great idea.
Dr. Laura McGovern, thank you so
Thank
much
you
for
so
talking
much.
to us today.
Thank you.
Pediatric hospitalist at PRMC.